Hi, my name is Audrey Schuetz, and I am speaking about troubleshooting of antimicrobial susceptibility test issues. And here we have a Candida auris for which the Amphotericin B test results are in question. And I'd like to discuss a little bit about the testing issues with Amphotericin B. So it has been brought up by CLSI and other studies as well that the reference broth microdilution method by CLSI may in fact be less robust than gradient diffusion strips in detecting resistance in Candida auris. On the table below with there's a publication at the bottom as well that this is pulled from. We can see here that there are these same isolates of Candida auris that are being tested by the UCAST reference method, which is very similar, not exactly the same, but very similar to the CLSI reference broth microdilution method, and compared over to the right-hand side to the gradient diffusion strips. And we can see here that the MIC 90 is much higher for the gradient diffusion strips reading as compared to the reference method. Now, we don't know which is true. This issue is under discussion at CLSI and is being actively investigated as to what is the truth for where the MIC really lies for these. But in the interim, we suggest for laboratories to consider reporting MICs and the CDC interpretation for resistance for Amphotericin B using report comments and explain the issues with Amphotericin B and Candida auris in the report comments. You might consider the comment that's shown here on the last bullet. Results for Amphotericin B and Candida auris may vary depending on the method used. Currently, it is not known which method produces the most clinically relevant results, and Amphotericin testing results should be interpreted with caution. In general, it's a good idea to use two different methods for testing Amphotericin B against Candida auris and choosing conservatively the more resistant result for the patient report. And remember, please, to always discuss these with the clinicians as well to let them know the concerns around the testing with this. Thank you.